steps to safe motherhood and child development. It is truly a privilege to open the floor and share my thoughts on a topic that lies at the very heart of our collective aspirations for a better continent in Africa and, of course, a better Nigeria. Health and sustainable development goals with particular focus on the critical steps required for safe motherhood and child development. Today, as we gather, united in our commitment to achieve the ambitious targets of the Sustainable Development Goals, particularly Goal 3.1 by 2030, which is to reduce the global maternal mortality ratio to less than 70 per 100,000 live births. And I recall, as Ahmed mentioned, when we took our last mentorship class, it was about really getting the team and the class to understand the difference and how the targets and indicators are there to enhance the actual life events to address some of these, challenges and to reduce this maternal mortality ratio as well as child mortality ratio. But generally, we're reminded of the profound impact that health outcomes have on every aspect of human life. And indeed, the health and well-being of mothers and children are not only fundamental human rights on a global level, and even in Africa, as it seems not so, but it's also an essential prerequisite for the achievement of all other goals, all of the 17 goals, development goals that we have from the United Nations. At the outset, it will be a good thing to acknowledge some of the works that has been done, the progress that has been made over the years in improving maternal and child health outcomes on a global level. Again, advances in medical science, increased access to healthcare services, and targeted interventions have undoubtedly saved countless lives and lifted millions all over the world out of poverty. It would be good also to recognize the significant progress that has been made in reducing child mortality. So, for instance, about 9 years ago in 2015, the mortality rate for children under 5 on a global level was 43 deaths per 1,000 live births. That's a 44% reduction since year 2000. And this translates to 5.9 million under 5 deaths in 2015, down from 9.8 million in year 2000. But despite this progress across regions, there are still wide disparities. In sub-Saharan Africa, there's a continuity to have the highest under 5 mortality rate, with 84 deaths per 1,000 live births in year 2015, about twice of what we have on the global average. One of the most glaring injustices of our time is the stark disparity in maternal and child health outcomes. So between high-income and low-income countries, while maternal mortality rates have declined globally, far too many women continue to die needlessly from preventable causes, from causes that the rest of the world are done with and are dusted, related to pregnancy and childbirth, with disparities widening even further in conflict-affected and marginalized communities. Likewise, the first 1,000 days of a child's life, from the conception to about age 2, represent a critical window of opportunity for ensuring optimal health and development. Yet, millions of children around the world continue to suffer from malnutrition, from stunting, from preventable diseases, compromising their long-term health, their cognitive development, and future potential. Against this backdrop, it is important that we redouble our efforts as advocates of SDG 3, particularly 3.1, to prioritize safe motherhood and child development as central pillars of our broad agenda for sustainable development. Without focusing and prioritizing that particular goal and target, we'll be doing a lot of injustice to all the other development areas across the sustainable development goals. But what concrete steps can we take? What can we do to translate our aspirations, our desires, into tangible outcomes on the ground? Firstly, we must invest in robust health systems that provide comprehensive, equitable, and quality healthcare services for mothers and children, regardless of their socioeconomic status or geographic location. And this includes ensuring access to skilled birth attendants, essential maternal and child health interventions, and life-saving commodities such as vaccines, contraceptives, micronutrient supplements, and so on. Another layer to that is to ensure that we are aware of the local imperatives on a community level, and we are leveraging and not discounting such existence. In a place like Africa, we know that across most of the rural areas, the traditional birth attendants, it's to study and pay attention to this category of birth supporters and be able to enhance their capacity by ensuring that they are carried along, they become as skilled as possible, and they're able to deliver essential maternal and child support as necessary. Secondly, we must address the underlying determinants of maternal and child health. Poverty, of course, across most of these low-income countries we have in Africa and in Nigeria particularly, the issue of extreme poverty and now even multidimensional poverty cannot be overlooked. Again, we must look at gender inequality. We must look at lack of education. We must look at limited access to clean water. We must look at sanitation and, of course, nutrition. Empowering and educating women and girls, promoting reproductive rights, creating the right level of awareness, and strengthening social protection programs are essential prerequisites for improving maternal and child health outcomes and breaking the cycle of intergenerational poverty and diseases. Thirdly, we must foster multi-sectoral partnerships and collaborations that transcend traditional silos and bring together government, civil society organizations, the private sector, academia, and communities to work towards common goals. By pooling our own resources, by localizing our solutions, by aggregating our expertise and networks, we can amplify our impacts, we can scale our interventions, we can leverage our synergies, and we can drive transformative change at scale. And finally, we must hold ourselves and our leaders accountable. We must carry them along. We must raise the topics that matter, and we must be able to tell them why it matters. For the commitments we have made to improve maternal and child health outcomes and advance the sustainable development goals. This requires transparent monitoring, robust evaluation, and regular reporting on progress, coupled with meaningful engagements and participation of all stakeholders, particularly women, children, and marginalized communities. I conclude like this. The journey towards safe motherhood and child development is long, is sometimes discouraging, it can be hardest, but it is a journey that we must all undertake with unwavering determination, with compassion and solidarity. By taking concrete steps today to invest in the health and well-being of mothers and children, we are not only fulfilling our moral and ethical obligations, but also laying the foundation for a more equitable, prosperous, and sustainable future for generations to come. I must encourage everyone gathered here today, together, let us rise in advocacy, in engagement, and in concrete interventions to the challenge before us as a continent and as a nation, and reaffirm our commitment to leaving no one behind in our pursuit of health and the sustainable development goals. Or in the words of Nelson Mandela, health cannot be a question of income. It is indeed a fundamental human right. Thank you once again for having me. And thank you for giving me the opportunity to deliver the keynotes for this gathering. Over.
Wow. That's an excellent speech by our speaker, Dr. Mori. Is there anyone that has a question to ask before? Is there anyone that has any question to ask? That was a wonderful presentation by our keynote speaker. So please, if there is anyone that has a question to ask before we call it a day, please, this is the time to ask question if you have any. And Dr. Garba, do you have anything to say? All right, then
maybe Ahmed, in terms of content, maybe
yes,
as value is to understand where you are at a subnational level in Jigawa State, and maybe we can exchange some information around, data. So for instance, some of the things we know in the current state of maternal and child health in Jigawa State, particularly as research has it, drawing from available data. And then
yes,
you can, so that maybe that can help us to, understand where we are at and what we can do for. So in terms of maternal mortality ratio, for instance, recent statistics has it that Jigawa State has one of the highest maternal mortality ratios in Nigeria, standing at approximately 1,154 deaths per 100,000 live births. If we compare that to the targets by the SDGs, I mean, we still have a long way to go. And this highlights the urgent need for improved maternal healthcare services and interventions in those states. If we look at child mortality, we also see that you're grappling with high child mortality rates. The under 5 child mortality in Jigawa is approximately 168 deaths per 1,000. Again, if you look at that relatively to the targets of a reduction of child mortality per 1,000 live births, you still see that there's a long way to go. This indicates significant challenges in reducing even preventable diseases that already have cures across the continent and on a global level, and improving access to healthcare services for children. So when we go to skilled birth attendants, data says that access to skilled birth attendants in Jigawa remains still limited, particularly in the rural and underserved areas. Many women still give birth at home without the assistance of trained healthcare professionals, increasing the risk of complications and maternal mortality. So this talks to, things about trained birth attendants, even given an opportunity for the traditional birth attendants to up their skills and to, because again, it does seem that like at community level, some of the women are more comfortable with these traditional birth attendants? What are we doing as a state to begin to look in that direction and, intervene and make them more, build their capacity and enhance, their productivity? So, for instance, also equip them with tools so that they are less prone to infections. In terms of immunization coverage, there's record that there's been some efforts to improve immunization in Jigawa, but disparities persist across communities because data indicates that only a fraction of children are allowed by their parents to receive some of these basic vaccinations. So these are areas, these vaccines already exist that address some of these vaccine preventable diseases. And so that's another scale higher than the regular preventable disease. Some diseases are there, but vaccines have been able to, things like polio, COVID, some of these diseases that children battle with. Vaccines are malaria now. I mean, there's a discovery around malaria. Malaria is highly killing a lot of mothers and children still across the continent. So again, is to look inwardly and begin to deliberately ensure that interventions around building advocacy and creating awareness to up the demand on some of these available solutions is being channeled in the right level, in the right volume across communities in Jigawa. So like I mentioned earlier, public engagement is a vital strategy for driving progress in these two areas, maternal and child health, at most of the subnationals across the nation. Community education and awareness, mobilizing community resources and support, promoting community participation and ownership, and of course, advocacy and public influence. So let me hang on there and see whether there's any comments or questions and any discussion that anybody wants to add. Over.
Okay, thank you, Mav. So is there anyone with or something to ask Mav before? Okay, Mav, I would like to ask Mav, what, like us, the SDGs Alliance, what are the strategies that you can advise us that we can employ in terms of advocacy in the state? Can you hear me, Ma?
Yes, I can hear you, Ahmed. Sorry, I was on mute. You work directly through the state government, Abi? So you work at subnational level, right?
Yes, yes, Ma.
Okay, so
We work under the
again,
SDSN Youth Alliance.
SDSN Alliance. Do
Yes,
you report to the state or do you report to SDSN?
we report to the SDSN.
Okay. So again, so what you're asking is what are the likely solutions that you
Yes,
can prefer to the
yes,
state, right?
yes, the
So again,
strategies that
like
we
I
can
mentioned, public and engagement, community education and awareness is critical. We cannot have too much of it. In a place like, and it's not just Jigawa State, we undermine sometimes we focus a lot on the medical supplies, the trained health worker. We forget that the people we're taking the solution to also need to be willing and be able to identify value in the solution that you are bringing. So it's important that there's public engagement initiatives that focuses on raising awareness about maternal and child health issues. We're in a place in Africa where children's deaths, mothers, they still are aligned heavily around superstitious beliefs. Sometimes when a child dies of malaria or yellow fever or jaundice, There's a story around it. So it's important that we keep on and we invest heavily, socially invest particularly on raising awareness of the health hazard inherent in maternal and child health, including the importance of antenatal care, skilled birth attendants, exclusive breastfeeding, immunization and nutrition. These are things that the world have overcome. The world have been educated verbosely around. And in Africa, we're still, either in denial or we're being really slow about it. Community-based education programs are essential in all of this conversation. It needs to speak to them, it needs to speak their language, and it needs to be prepared in such a way that they will embrace it. It can empower women and families with the knowledge they need to make informed decisions about their health. Another thing is mobilizing community resources and support. So again, with some of these public engagements, you can mobilize resources from local communities, from traditional leaders, from religious organizations, and such other stakeholders. And by doing that around the cause of maternal and child health, you can leverage existing networks and resources to strengthen healthcare system and expand access to essential services. But like I mentioned earlier, it starts heavily with education, with creating the right level of awareness before one can agree to mobilize resources. Is that fundament of agreeing that indeed this is a solution and it brings value to us as a community. That's where it starts from. And that's where the major investment should be, is the acceptance by the people that should be prioritized. Again, maybe promoting community participation and ownership is essential. So sometimes you bring a solution and it appears foreign. There's a tendency that it will not be accepted easily. Engaging communities in the design, in the structure, in the plan, in the implementation, monitoring of these programs gives them a sense of ownership. And once people feel, they belong, then it's easier for them to be accountable. When you involve community members, you can ensure that interventions are culturally sensitive. They are responsive to their local needs. And again, that's by default just breeds sustainability on the long run. If we focus a lot, besides the general advocacy and policy influence, if we focus on the first three, we will have significant progress in a state like Jigawa State. Yeah?
Yes,
Okay.
ma'am. There is another question by someone, by Dr. Garba. He's asking that, what can we do about those people that prefer to give birth at home rather than going to the hospital?
Yeah, so thank you for your question. That's the biggest hurdle that surprises us the most as social experts in a continent like Africa. You see, we shouldn't be surprised anymore that we have this modern and sophisticated skills and knowledge and solution around healthcare and providing quality healthcare does not automatically translate to value or to acceptable value by community members. We must let this sink in us as advocates. The process of delivering value are two-sided. One is the person who is giving it, the other one is the person who is receiving it. Both of them need to agree that this is value to me and this is solution. So they are not accepting it because they've not seen the worth. They've not been able to identify value with it. They think it's fables. They think it's lies. They think you're just playing around. They think you've come to introduce something strange to them. And that's where demand is. And that's what I said earlier when I addressed the matter of education, community education and awareness. This is critical. Sometimes, it sounds almost too we say it so often that we forget how important and how impactful the continuity of it is at community level. And it's not a one cap fits all. It needs to be localized to a precise culture and what is acceptable to the community in question. It's not a generic way of educating and creating awareness. It needs to be able to stand and be able to address what is important to that particular community that we're addressing. So again, to that question, I would say that you must prioritize community education and awareness before you start even intervening, before you start calling them to come to the healthcare center that you have just mobilized resources to make more fanciful or finer. You must understand that some of them just will not come with you because they don't see value or they don't understand value yet. Over.
There is another question by Grace Bernard. How can family planning be improved in the background of religion and culture?
Two things for family planning. I will talk first and foremost about the awareness of reproductive health, and also introducing reproductive health at an early age, so that as the women mature, they are able to make informed decisions around family planning. So again, reproductive health is not a very popular topic at this part of Africa, and we must address that situation. It's a health topic, especially for women, for the vulnerable, especially women, and therefore it also needs to be spoken about. But again, as we know culturally, you cannot just educate the woman about reproductive health or family planning and not carry the Megiddo along, the man of the house along. You will just be embarking on futile efforts. So it's important that we holistically consider the family, since we call it family planning. It's not woman planning, it's not girl planning, it's family planning. And as we know culturally, the man is the head of the house in the African context. And nothing is going to take that away. So it's for us to, again, customize our solutions. And as much as possible, maybe even first and foremost, educates the men and not take it for granted that, oh, it's just to donate the sperm and leave the scene. Sometimes some of these men require, this level of education that we take for granted to be able to support their wives, so to say, in making some of these decisions. Over. So Hamed, I think that's fine. Have we answered all the questions?
Yes, we have, ma.
Brilliant. Okay. So it gives me great pleasure to be at this session. I don't know if any other person has a comment.
Okay, we'd like to really thank you, Ma, for honoring this session. For taking your time. I know you are a very busy individual, but you show your commitment towards addressing the issue of maternal and neonatal health, and we are very grateful for your time. Thank you, ma'am.
Thank you for having me, and have a great evening, everyone. Thank you for coming. I wish you all the best, and Ahmed, feel free to get across if you have further questions you'd like us to address, or if you'd like us to support any of the works ongoing. Thank you,
Definitely.
and have a blessed day. Bye-bye.
So everyone, thank you for attending this webinar. I'd like to also thank the SDGs Youth for giving us access to this Zoom platform, and everybody else. So thank you very much for your time. See you in our next webinar. Bye-bye.